common skeletal condition for canines. Canine hip dysplasia. What is canine hip dysplasia? This is defined as abnormal development in dogs that happens as they are growing, where the head of the femur does not fit correctly into the hip socket. This can lead to osteoarthritis. This occurs when the head of the femur, which is the ball, and the hip socket on the pelvis do not grow at equal rates. This condition can cause inflammation, which can lead to swelling, stiffness, and pain. This disorder is common in large breed dogs. This diagram will show you what a normal hip looks like, what the moderate stage of hip dysplasia looks like, and then extreme hip dysplasia. And as you can see, you have a deformed femoral head, and the hip socket is deformed as well. What symptoms should dog owners look for? So clinical signs can vary for hip dysplasia, but there are some things that you should keep an eye out on. There's weakness and pain in the hind legs, limping and reduced range of motion. Your dog will become reluctant to climb the stairs. They can appear wobbly when they're standing, and almost a bunny hopping sort of gait as they move about. They can also be reluctant to get up from a sitting or laying down position. And even though hip dysplasia begins in puppyhood, this is a chronic condition that takes years of bone degeneration for a dog to display any symptoms. Over here we have a radiograph, a bilateral radiograph, which shows both sides of the hips. And as you can see on this side, we have that deformed femoral head sitting in that deformed hip socket. How to diagnose CHD? So one of the first things a veterinarian is going to want to do to examine the hip joint is to physically manipulate the movement of that joint. So in a dog with CHD, the flexion, which is the bending, and the extension, the straightening of the hip joint, would be painful. Also with CHD, the abduction of the hip, which is where the outward movement of the femur bone towards the midline of the body, would be also restricted and painful. Diagnosis of CHD is performed by a combination of two different methods, specifically position the hip joint x-rays with special palpation methods that can determine abnormal hip laxity, which is the looseness of a limb or muscle. This method requires light sedation. A hip radiograph should also be performed right away if it is suspected that the dog has developed CHD. Treatment methods of CHD can depend on how uncomfortable the dog is, as well as with what clinical signs the dog would be showing. So anti-inflammatory drugs are often the option to begin with, and this can also include additional medications like gabapentin, which is a pain reliever. Surgery is also an option, but that's typically for more severe cases, and different types of surgery are more beneficial based on the age of the dog. An example of one of the surgeries that can be performed is a triple pelvic osteotomy, which is best performed in dogs that are under a year of age. And then there's another example, which is a hip arthroscopy, which is minimally invasive and can repair the cartilage in the joint. Discussing CHD is important for dog owners because it is a condition that can occur in any dog breed, although it is more likely that a larger breed is going to develop CHD. This disorder is also genetic, but it can be affected by diet, exercise, growth rate, hormones, and even their environment. So it's recommended to make sure puppies maintain a healthy weight while they are growing.